I came as a young psychiatrist in 1976 to what was then Prestwich and Hope Hospital, and I've stayed working in the same trust in all its reconfigurations, and I'm now entering the last year of my clinical practice, and I don't want to leave my clinical practice when I feel things are in crisis. As I stood down from being president of the Royal College of Psychiatrists in the last 2 weeks, I happened to say on television that I thought mental health, and particularly children's mental health, was a car crash waiting to happen. The Secretary of State did not take this too well. I don't link the two things, but then 6 weeks later they opened up a workforce for CAMS, a task force, about how we might improve child mental health services, which has involved the possible belief that it might need a bit more money. So you have to persevere. So the 4 things I'm going to look at is 1, what the legislation gives patients, users, carers and the workforce the right to ask for. 2, the crisis in mental health beds, which is what our college is now taking forward in a campaign. 3, what I've seen on the impact in community mental health services. And the one I think that will be left behind and become the elephant in the room, and that's the impact all this is having on my colleagues working across mental health, that they are increasing with work-related stress and they're having their own mental health problems. And that is not the way to look after a workforce. It's wastage. It's wastage. Even if they're not interested in the workforce, it's a waste of money. So number 1, the legislation. I guess many of us weren't too keen on the Health and Social Care Act, and many of us stood out and tried to oppose it. It went in. The one thing we got in the Health and Social Care Act, and they told me at the time that they'd do it anyway, and I took a sort of value judgment. I thought, well, maybe I don't trust the politicians, was to have parity between mental and physical health care. That is in legislation. Use it. Use it at every level. Use it with your MP, use it with your local councillor, and above all, I don't know whether Stockport's got one, but with the Centre for Mental Health, we set up mental health champions in local councils. It was Kevin Jones who suggested we did this. They may have nothing to do with hunting for mental health in their local council, but they're there. Go and talk to them, because they'll go to the local health and wellbeing and the CCG. Use them. So that's, so first of all, we have, right is on our side with the legislation, and that only happened in 2012. I'm going to talk next, because I know I've got limited time, about the beds, and my successor, Sir Simon Wesley, who's married to Claire Gerardo, who you know did quite a lot of lobbying for primary care while she was chair of the GPs. Critical shortage of mental health beds. And just a few facts, because facts are actually power. Between 1998 and 2012, there's been a 39% decrease in the number of mental health beds available. If that had been in cancer care, this room would have been so full of television crews, you'd have had to go and stand outside. So the number of mental health patients are forced to seek emergency treatment outside their local area has doubled. More than 3,000 people had to be sent outside their local area for treatment, up from 1,300 in 11-12. The numbers are going up. Patients are now being sent as far away as 300 miles away from home. I've got young doctors, young trainees who have been put off doing psychiatry, which is the best branch of medicine. I'm proud to be a psychiatrist, because they have to sit with a 17-year-old who's psychotic and their parents, and the only place they can get a bed is 200 miles away. And that young person is not in a good place when they're ill. The shortage of beds has been led to patients being sent home, and I think we should watch the suicide rates very carefully. I don't believe they're just rising in the prison population, and it can't all be down to austerity. If we can't give people the service they need, those people are at risk, and as I understand, I think those who run the NHS are interested in safety. And as far as I know, suicide is a safety issue, unless I've come from another planet. So the bed crisis is having a really heavy impact on children. So one of our solutions, and you may think that what I'm saying is a bit remote, but I have to think strategically if you're going to impact on policy. I think what we've got is that actually the policymakers are getting it. We've got all 3 leaders. I've not been to UKIP, that will be my successor's job. to pledge to mental health and to get the disease burden and the level of money to services nearer together rather than the gap we've got at the moment. So belatedly, they've recognised that mental health matters and it's a solution to a lot of other problems in society. But such is the fear amongst the systems that are commissioning and providing that they act with free-floating anxiety because they don't believe that the money will come through. So Nick Clegg's pledged 120 million. I understand today that the Shadow Chancellor is going to say that the money that the banks, they've recouped from the banks will go into health. So we need to argue for that to go into mental health. Those are jobs we can be doing whilst firefighting with a crisis on local patches. But actually, I don't know whether you've thought about it, the people we should be asking to review the beds are the people who have responsibility for population health, public health England. So I think you should start having a go at them and saying, what are you going to do about it? So that's inpatient beds, crisis. You know, when our trainees did the survey, we had one unit in London that had 137% bed occupancy. I don't know whether they were topping and tailing them, hoping that they'd come back cured after weekend leave. Sorry, I used the word cure, I apologise. I don't know, but that's what they had, 137% bed occupancy. I don't think that would happen on a cancer ward. Okay? Community mental health services, we're seeing being decimated. And I understand that there's always efficiency savings and there's always better ways of working. But to leave staff and patients, users and carers who've known that staff, built up trusting relationships over 2, 3, 5, 10 years, and then even when they mix it up and reduce the number of teams, they don't even match people with people they know. That just seems to lack common sense. So that's community mental health services. But what I want to finish on is what is actually worrying me most. So yesterday we had a conference at our college called Enabling Environments. Now I understand what the government wants for the workforce here. They want us to have care and compassion. To be able to put care and compassion into practice, you have to be treated with respect. You have to be understood. You have to have time to reflect on what is a difficult job. Enabling environments is something that can be given into trust to help them understand that there's a triangle to care and compassion. There's the user of services and listening to them because they know best with their carers. The workforce, because we know best, because we do it day in, day out on the ground. And there are trust boards and middle managers, and we need to work with them. But what's happening now is that we haven't got enabling environments, and the risk is that environments become toxic. And if environments become toxic, our practice starts to fail. And actually the solution to a lot of the ills of the whole of society, whether it's economic pressures or actually getting a productive workforce across the board, is actually about mental health. So I'd like you to add to your campaign, Hitting Hard Public Health England. Do you know the pittance we spend on public mental health? It's minute. Do you know the pittance we spend on child mental health prevention? We don't even know because nobody thought it was worth finding out. And yet we know, and many of the users in this room know, if they'd had the support in their very early years, we would not be on the pathway that we're on now for many people. So I want to be solution focused. I know that people are going to talk much more pointedly about local pressures, but please, you've got to run 2 campaigns in parallel at all levels and in all ways. You need to network more with the rest of the country. And you need to ask why actually in parts of the UK things are slightly better. And you need to ask why in Scotland they're still managing to do things a little bit better on what is actually less money, and learn from our brothers and sisters. So thank you for listening.